Hello and welcome to another episode of Medical Insight series. Today joining us is Mr. Simon Shammas. Welcome, Mr. Simon.
Thank you very much, Michelle.
How are you?
Fantastic, excited to be here.
And we're excited to have you too. So Mr. Chammas is a certified instructor of Mindfulness-Based Stress Reduction, also known as MBSR. This scientifically researched method is changing the way people respond to stress, pain, and the demands of everyday life. Mr. Chammas, can you please start by telling us about your qualifications?
Yes, absolutely. It starts with personal practice, so discovering meditation for myself since 2011, actually through my practice of yoga originally, and deciding to train to have a certification as a teacher and I trained with the Brown University in Rhode Island, and the Brown University Center for Mindfulness.
So for those who may not be familiar, how would you explain mindfulness-based stress reduction in simple terms?
Yes, maybe starting with stress. What is stress? Stress is a fantastic survival mechanism that we all have, all humans, and many animals as well. So for example, if I put my hand next to a stove and I feel the heat and I'm burning myself, it's the mechanism that will allow me to pull my hand away without even thinking about it. The issue is our brain does not make a difference between an external stimuli, such as my hand on the stove, or an email to my boss. And so sometimes stress can take up our thoughts, our stressful thoughts, and start this reaction, this physical reaction, that is increased heart rate, increased sugar in the bloodstream, and many other consequences. And if not deactivated, right, if the brain does not get a signal that a thought is just a thought, an email is just another email, then the body may react as if there's actually a tiger in the room when there is none, and we're not at this level of threat.
Okay, and how does this relate to mindfulness-based stress reduction?
Mindfulness-based stress reduction is about strengthening the prefrontal cortex, this executive part of the brain that is able to notice what's going on physically and outwardly, and able to make the difference between a life-threatening situation, a tiger in the room or my hand on the stove, and a thought, or maybe a recurring thought, or maybe feeling tired or something that's going on inside in the mind or in the body.
We are told that MBSR is described as scientifically researched. So can you share a bit about the science behind it?
Absolutely. Actually, the program was born out of a hospital setting. The founder, Mr. Jon Kabat-Zinn, was working together with the University of Medicine of Massachusetts. And he basically came to them and said he himself was a very avid practitioner of mindfulness and yoga. And he said maybe it can help out people. That's back in the 70s. And so he asked to his fellow doctors, send me the patients for whom traditional medicine is cannot offer anything anymore. Chronic pain, people maybe in terminal phases of cancer, or with very serious conditions with which science cannot do anymore. And with the results of this program that he set up within the hospital, doctors got interested and said, okay, so there's something going on. MRI was coming up in the 80s, so research was starting to be born, and the program got strengthened with this. Now there's a host of research that shows a decrease in blood pressure from following the program, decrease in pain medication use, better pain management, sometimes even decrease in the symptoms. Even there's a study back in 2010 that even shows increase in brain matter. Yes, the studies are plentiful. Spearheading the research, there's Brown University in the US, UCLA as well, and Oxford University in the UK. So these are some of the major ones that are pulling ahead with the research.
A big part of MBSR is learning to pay attention to the present moment in a non-judgmental way. So why is this so powerful in today's world?
Yes, there are so many stimuli today, right? Well, most of us have a smartphone, and you may have heard the expression push notification, right? We're getting pushed. We're getting pushed all the time, and there's a never-ending race to productivity. And this push calls for reactions. The issue with that is that we enter this, people may have a tendency to enter a cycle of reacting. And the difference between responding and reacting is this moment of awareness. So how do we entertain and cultivate this strength of awareness in a moment where our attention is, we're in the attention economy, right? Our attention is always asked for everywhere, all the time. On top of our roles and maybe in work, in our families, it doesn't stop, right? Because we have the smartphone that's an extension of all those demands. Mm-hmm. So how do we reclaim that attention that is being monetized?
A question for those who are interested in doing this program with you. After, say, how many sessions do you think that they can see some improvements for themselves? Or how would you say the program should be for them to expect to see some changes in themselves?
Yes, well, MBSR itself refers to a cycle of 8 weeks with almost an hour a day of meditation. And each week a masterclass of 2.5 hours, up to 3 hours, and even a half-day retreat in the middle. So it's a very extensive program for people who follow through and invest the time that the program requires, because nobody's behind them checking if they actually do the meditation during each day. The effects can be significant. My experience is it really varies with people, how far along maybe they already have some level of mindfulness practice, whether they recognize it or not in their lives. People who are already attuned to arts, for example, maybe people who are already used to doing yoga. These people may see results within a month, I would say. For some other people, it may take longer, so 8 weeks, 2 months. It really depends on how much time the participant is willing to pitch in.
So it depends on every individual then?
Yes.
And what kind of benefits, physical, emotional, or psychological, do people typically experience when they do MBSR regularly?
Varies greatly from where they come in with this practice, where from. Most notably, better sleep, reduced symptoms of elevated heart rate, so better heart rate, reduced symptoms of inflammation for some people if they come in with this problem, and more broadly, less maladaptive responses. So there's also a version of the program that caters to chronic depression, so less symptoms of chronic depression, better emotional stability, better emotional availability in human relationships with loved ones.
Is there anything else you'd like to add for our viewers?
Maybe a question. It's, are you aware of your breath? And this moment of trying to answer this question is already awareness right there.
Well, this has been deeply insightful. Thank you for today's conversation and sharing your wisdom and experience with us. For our viewers, if you are interested in speaking with Mr. Shammas, please have a look at his details below. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in.